all for on behalf of Dr. Reddy's family. So today we are going to talk about the restoring the balance of dysbiosis and management. So there are various reasons the dysbiosis occurs. There are always a good bacteria and the bad bacteria. Whenever the imbalance occurs, it is called as dysbiosis, and for that we need to restore this balance. So for that expert we have today Dr. Jubin Dev Sharma sir. Sir is a consultant gastroenterologist working at the Medicity Hospital, Gurgaon. Sir has done his MBBS from the Maharashtra University of the Health Science in 2008. Then Sir has done his MD Medicine from the D.Y. Patil Medical College in the Maharashtra itself. And Sir has also done DNB in Gastroenterology from the National Board of Examination, New Delhi. Sir has over the 1 decade experience in this particular field. So I warmly welcome Dr. Jubin Sharma sir for today's session. Over to you, sir.
Thank you very much, Dr. Shashank, and I want to thank you and Dr. Reddy's for giving me this opportunity to speak on a topic which is, very frequently talked about, but very less understood when we really see, and in general for public, it's a topic which they have often read about in newspapers and magazines, but it is something which still sounds very utopian or very Greek, but in fact it is much closer to us, as gastroenterologists, and much closer to our problems that most of us face. So I'll try to tell you or try to talk about the nuances that are there in trying to manage dysbiosis and where all it actually fits in the various disease spectrum. So, what is dysbiosis? To briefly talk about it, I need to go back to some basic concepts in biology. We are not individual human beings. Just imagine that we are not one human. We actually are complex organisms which have further smaller organisms inside of us, and these microbiota, what we call the human microbiota, these are necessary for our survival, for our living being. If we don't have these bacteria inside of us, we won't be able to survive. So nature has created us in such a way that we have certain bacteria inside of us which are necessary for our survival, and this is called as simply a symbiotic relationship. So and particularly most interestingly, it is our gastrointestinal tract that has the most densely populated microbiota organ, although they are also seen on our skins primarily, on our facial hair and everything, but the most densely populated area or organ where we have bacteria is our gastrointestinal tract. And our gastrointestinal microbiota, interestingly, is very, very unique in its nature. It keeps on changing with different phases of your life. As you grow older, you tend to have some different set of bacteria. If you move from India to, let's say, United States, your microbiota might still change a bit. Some part will change, some part may not change. And it's this microbiota which gives you a significant, your actual immunity is here. It's not your own immunity, it is your microbiota inside you that creates your immunity. So what are the main bacteria which are inside that create your biosis or microbiota? Those are the firmicutes, the bacteroides, and the actinobacteria. These three are the backbone, and the various subspecies are the backbone of which is your human microbiota is based on. So I usually use a short form for it called as FBA or BAF, and I try to remember it with that. So what is eubiosis and dysbiosis? Eubiosis is, these are fancy words actually, and they simply mean maintaining your normal microbiota is eubiosis. And whenever you have a loss of balance to this, that for example you have your bad bacteria which are overrunning the good bacteria, for example Enterobacteriaceae family and many others, that is simply called as dysbiosis. This means something is getting bad. Okay. And so, what is the role of this eubiosis or the bacterium? So, in fact, it has so many roles that some of them we don't really understand. It has an immunomodulatory role. In fact, in every known gastrointestinal disease, there is a role of microbiota. For years and years, we have been talking about it. It regulates your metabolic process. In fact, whether I'll tell you very interesting study. There was a study done in I think US, Mayo. I'm not sure, but yes, where they knocked off certain some bacterium in a mice, and these mice developed obesity. They became obese, and the moment they reintroduced it, they lost some of the weight and they again become healthy. So even obesity actually has some regulation done by your microbiota. So whether we all know of some people who eat a lot but they never seem to get fat, whereas there are some people who always eat a small thing but they still get fat. Yes, there is a role of your genes, there is a role of your metabolism, but there is a significant amount of contribution also coming in from your microbiota. It also plays a role when we talk about in your cytoprotective cells. It also plays a role in metabolism and creation of multiple vitamins. So overall, your bacterium are responsible for our good health. It is not only you. So what are the factors that can change? The factors that can change these bacteria are various things. Let's divide them into internal factors and external factors. The internal factors is your genetics, your mucosal barrier on the intestines, your inflammation, your immunity levels, and everything. But what is external? So what is in your hand is your diet. And that is why our ancient wisdom of Ayurveda and all those things tends to come into being. And our elders, they used to tell us to eat this kind of food and this kind of not food, because they knew how to manipulate this microbiota. So it was this manipulation of microbiota done by our ancient Veds and all that actually led to a better survival, although we sometimes don't believe in it, because right now we can't prove it. It's an era of evidence-based medicine, but that was a basic concept. And further, if we talk about if we keep on taking multiple antibiotics, we do have a lot of stress nowadays in our lives. We smoke or taking alcohol and other things. All these are external factors which do change your microbiota, and therefore they lead to dysbiosis. So factors which you can control versus factors which you can't control. So this is how you would have to divide. So as a patient, as a doctor, and even as a common man, I have to focus on things which I can control and not something which I cannot control. So, what is our GI tract prone to? We develop diarrhea whenever we have a dysbiosis. Sometimes we also develop a symptom of bloating. We feel full after eating. We just don't feel good. We feel ill. So a lot of changes can happen. You can have actual diseases like inflammatory bowel disease, or you can have a disorder of gut and brain system, where it is called an irritable bowel syndrome. You can have infections like H. pylori, or even you can be prone to develop small intestinal bacterial overgrowth if you keep on popping multiple antibiotics. So, what is antibiotic diarrhea? It is something which is very common. Almost one third of all the antibiotics, they produce diarrhea, and by various mechanisms you can increase the bacterial growth, or they lead to more leaky capillaries inside your GI tract, and overall you have a decrease in the butyrate producing bacteria. So antibiotic associated diarrhea is also something which is very common. Similarly, in diarrhea, you get IBS or irritable bowel syndrome. In these patients, it is one of the very common functional GI disorder. We don't use the word functional now. We primarily use the word as disorder of gut-brain axis. So this disorder of gut-brain axis, IBS, is the classical one. It is we have scientifically proven now that there is a disruption in the intestinal barrier. There is significant dysbiosis. There is an increase in the Escherichia coli colonies. There is a decrease in the Clostridium leptum group of bacteria, as well as Bifidobacterium. If you remember the BAF, the first one was Bifidobacterium, and there is decrease in the bile acid biotransformation, which is again a responsibility of Bifidobacterium, the first of the BAF biotic cells. That is why this is one of the hallmark disease where the modulation of your biosis can actually lead to development of symptoms and as well as treatment. Inflammatory bowel disease is altogether a different modality. It has two forms, Crohn's disease and ulcerative colitis. And there is a increase. If you talk, there is multiple pathogens, multiple mechanisms which are in place for inflammatory bowel disease. But when you talk about the dysbiosis in them, it is the increase in the virulent gut bacteria like the Enterobacteriaceae family and the Bacteroides fragilis, and there is a decrease in the firmicutes, the F from the BAF, like Faecalibacterium prasunci and Rosebury hominis. If you talk about H. pylori, we all have heard about it. Almost everyone in the world has infected by it. We tend to get its colonization when we are young, as children, particularly in developing countries like India. And there is an absolute increase in the proteobacteria, followed by the firmicutes, bacteroids, and actinobacteria. We have to use multiple antibiotics then when we are trying to treat H. pylori infection. And there is a role, definitely a role of probiotics when we are trying to treat H. pylori infection. And when we talk about probiotics, when I just mentioned it on H. pylori, but probiotics are living microorganisms. They either can be yeast or bacteria, but they do have a health benefit when administered in adequate amounts. Why do you think, all, our ancestors, they told us to use curd and, lassi and chach and all. If you travel all over India, you will have some kind of fermented milk drink available, even in this small villages. If you go to villages in Haryana, they will give you lassi. If you, particularly in summer season, if you go, somewhere in Maharashtra, they will give you all those chats. Or buttermilk is very common. So this is something which is a natural probiotic drink. I know something which we always had. We have had it for hundreds of years, but now we brand them and probiotic drink and everything, and we sell them off with a premium. Whereas and which is something which we always had, and it is this probiotics that we really need. That is why we had those created. They help us to maintain our gut flora. They help us to avoid colonization by pathogenic organisms. They have a direct protective effect on the intestinal tract, and they also had help in the maintaining of various remission of disease, something like inflammatory bowel disease. That is why the probiotics, they help us restore the balance. If you have to maintain it, you can maintain it by natural means. If you have to be treated for it, for example, if you have a disease because of it, then you will probably get in a medicinal forms, which we commonly use as tablets or capsules or probiotics. But not all medicines which are probiotics are same. It is strain specific and variant specific. There was a study which looked at various companies and products which were there, and most of them were incorrectly labeled, or some of them had contaminants. Therefore, WHO now recommends that you really need to register which strain a company is going to use as a tablet form and in an international depository, which can be then compared subsequently. So, as I said, it can be either a yeast or it can be a bacterial. The viability of GI environment is unaffected in yeast. There's no resistance. It is naturally resistant to associated antibiotics that we take, and it does not interfere with your normal gut microbiota. So, what is a prime example of a yeast-based one? That is the Saccharomyces buladi. So Buladi was, it was one of the probiotic yeast discovered in 1920. It is was first yeast to be identified used for medicinal purpose. It naturally survives your gastric acid, and it can be used for treating diarrheal diseases for years. And it does help to restore the natural microbiota. So it has a multi-pronged mechanism of action. It, as I said, it helps in maintaining your biosis. It has an anti-inflammatory effect, and it also affects at itself as a prebiotic. Prebiotic is something that are those are small products that help the natural bacteria in the colon to grow. So it also works as a prebiotic. Thereby, it helps you if you get treated along with your routine treatment. If you get treated with a Saccharomyces boulardii, you might help heal faster. So it acts against pathogenic organisms like E. coli, Salmonella, Vigoride, but not directly as it is certainly not an antibiotic. but what it basically does is it helps you to get it treated along with the other antibiotics, because it's being a yeast, it is not naturally destroyed with when you administered with other antibiotics. uh, Yeah. So when supplementation, it modulates, as I said, it modulates the microbiota along with the antibiotic. It blunts the E. coli growth, and it decreases the diarrhea score, decreases the possibility of antibiotic associated diarrhea, and it can be given for around 2 weeks. Various trials, as shown in this particular slide, have shown that it is effective, particularly for antibiotic associated diarrhea. If we talk about chronic idiopathic diarrhea, particularly in functional diarrhea or IBS, we have seen that it has no impact on the healthy controls, but in patients of IBS or in idiopathic diarrhea, it does restore biosis. So there is a decrease in bifidobacterium, and there is a decrease in the fecal mucus production, as well as an overall improvement in the parameters. So it does improve diarrhea symptoms in almost two-thirds of the patients. In IBS, we have done so much of research across the world now, but we still haven't found out the exact mechanism. So what a Saccharomyces boulardii does, if you supplement it, it decreases the pro-inflammatory cytokines, and it increases the level of anti-inflammatory cytokines, and it still improves the quality of life scores and decreases the symptoms. We naturally use antispasmodics when we are trying to treat IBS in pain. If you add an Saccharomyces boulardii to them, and definitely they will have a superior resolution of various symptoms. It does also help in inflammatory bowel disease in along with the other medications like mesalamine or biologicals or even steroids. And during flares, if used along with rifaximin or other antibiotics, it does help to get patients into remission. And in H. pylori, it has been now recently been shown as it has to be a part of the H. pylori eradication program. If you add, Saccharomyces, you will have a higher clearance of H. pylori, as well as a better treatment compliance, because it does mitigate the effect of the multiple antibiotics you are going to give as a part of H. pylori eradication regime. So, after reading all this data, we have realized, and WGO has also said so, that Saccharomyces boulardii, evidence-based, is antibiotic-associated diarrhea as an adjuvant therapy in H. pylori eradication, in treatment of infective acute diarrheas, and most importantly in IBS. In IBD, we all give, but it is still a recommendation in progress. So every day, the recommendations of probiotics, and particularly for Saccharomyces boulardii, is slowly increasing. So it's one of the best probiotic, yeast based probiotic available, and it's a level one recommendation. So key takeaways that you really want to know is the normal intestinal microbiome functions as a practically a bioreactor, and it helps to condition your body and immune response. There are various factors which can lead to dysbiosis, both internal factors and external factors, something you can control, something you cannot control. There are probiotics which are available in natural form, dahi, lassi, charge, as well as in supplementary form, like Saccharomyces boulardii in the form of tablets or capsules, which we have to use sometimes because, particularly in acute settings, and the efficacy of these have been studied in various clinical conditions, something like antibiotic-associated diarrhea, or even H. pylori infections or irritable bowel syndrome, and also in inflammatory bowel disease. And dysbiosis has also been proven in various neurological illness, something like Parkinson's disease or Alzheimer's disease. So it is not just your intestinal tract that you are working on; you're also working on neurological tracts. And adjuvant therapy with Saccharomyces does help to mitigate the disruptive impact of the concomitant antibiotics, and aids to restoration of your normal microbiota. Thank you, and I'm happy to take any questions.
Sir, thank you very much for your wonderful presentation. There are few questions in chat box. First question by Dr. Alok. Uh, what are the safety aspects of probiotics after prolonged use?
So most of them are very very safe. It is practically no known side effects of taking long term probiotics. It does not lead to increase in GI infections. It does not lead to any dependence. Only contraindication that I can think of is if you are immunocompromised from any sort. For example, you are a patient who has received a solid organ transplant and you are receiving tacrolimus and other drugs, which is a natural, which is artificially your immunity is depressed by medications. Or if you are a patient who is currently on chemotherapy of some kind with very much decreased neutrophil counts, like ANC is less than 1,000 or 1,500, those are the conditions where I will probably not give you a probiotic at all, because that's where these otherwise harmless bacteria can become harmful. But otherwise a natural in a natural immunity person, it's not contraindicated.
Right, sir. One more question. Sir, does probiotic help in the reducing the IBD symptoms, and what duration it should continue?
It does. It does help. As I said in my slide, it does help to reduce the symptoms as an adjunct to existing medication. It is not to be used in isolation. I'm not saying it's a replacement for standard drugs like mesalamine or azathioprine or steroids or biologicals. But yes, it can be used for almost 3 months, 4 months, 5 months sometimes, and depending on response. What I personally do in my practice, I keep on adding them cyclically. I will not probably give them it for 3 months in one go. I'll give them for a month, then I will give them a break for some time, and then eventually, if they have some symptoms, I will reinitiate it for some. So it's a cyclical thing that I keep on giving them.
Right, sir. One more question from Dr. Jagdish. How to check my gut microbiota white tests?
So normally it's not needed. There are various companies which are now doing it at a commercial interest. They take a stool sample and they'll try to analyze, or they will try to analyze their microbiota signature by taking their RNA, and all this is commercially also available, but as a matter of research. But in a normal person or normal patient, you don't need to really look into your microbiota. If you're otherwise a healthy person doing a normal job, it's not that you will look into a microbiota profile and then try to change it to become better. That's not how it works. And because it's a very individual thing, there is no standardization. Even if you test it, you will not know, okay, what is normal and what is abnormal. So what is normal for you may be abnormal for me, because it's like a fingerprint. No two fingerprint would be same. So you can't have a standardized microbiota for anybody. Okay, you try to get the point. If in case you will see a report which says, okay, increase amount of bifidobacterium, but you are healthy, you have no symptoms, so that doesn't mean that you need to treat yourself. But on the other hand, there are conditions like small intestinal bacterial overgrowth. To diagnose SIBO or such things, we do sometimes aspirate from duodenum or jejunum, and there are special tubes which are available. But those things are to make a diagnosis. I will not recommend anybody healthy person to go and check their microbiota. Some companies are doing it, but it is just a waste of your money.
Right, sir. One more question is there. Sir, how to assess if a patient has dysbiosis, and once a probiotic is prescribed, whether the dysbiosis is taken care or not?
Yes, so how to assess? First thing will be clinical. Some of the symptoms that are frequent are bloating, altered bowel habits, sometimes diarrhea, sometimes constipation. As soon as you eat, you want to go to the motion. So these are some clinical signs which tell me that there may be dysbiosis. Then there are some existing clinical conditions like IBD, IBS, H. pylori, where you will need some amount of there will be dysbiosis, so you will need some amount of supplementation with probiotics. And once you start them, it will definitely get better. In fact, it has to be a combination with the other existing therapy. It's not in isolation. So you will get better, and particularly if you're getting supplements with the Saccharomyces Buladi.
And sir, one more question is there. Difference between bacterial and yeast probiotic and your preferences as per your experience.
So initially, yeast probiotics were not very much in use until this particular species came into being. What predominantly is available by most companies is bacteria based probiotics, but there are a lot of issues with it. One thing is that you have to maintain a cold chain, you have to store them properly. It can't be just lying in the room temperature, particularly in a country like India. They get deactivated and they won't work. Second thing is they are not naturally resistant to the concomitant antibiotics that you are going to take. So if your antibiotics is going to work on your bad bacteria inside your stomach, it can also work on the probiotic that you are taking. It's taking simultaneously, so they won't really work. That is why we use yeast based now, which is Saccharomyces. So it is naturally resistant to the antibiotics, like whatever you take, azithromycin, amoxicillin, and other drugs. Whereas and you don't need to really maintain strong cold chain for this. So it is better to use uh, Saccharomyces boulardii.
I think there is no more questions, sir. So thank you very much, sir, for your wonderful presentation, and thank you all the audience for joining today's sessions. Thank you all.
Thank you. Thank you.
Technical team,
Yes, sir.
yeah, please conclude the session.
Okay, with your permission, I'd like to end it. Thank you so
Okay.
much. Have a nice day.